Dear friends, I am Dr. Gaurav Ganeshwala. I am a consultant cardiologist working with Ruby Hall Clinic, Pune. COVID-19 and heart disease is a growing concern, especially with increasing cases of heart-related complications seen during the second ongoing wave of COVID-19 pandemic. This COVID-19 pandemic so far has affected more than 18 crores individuals globally and over 3 crores from Indian population. More than 2.5 lakh individuals have lost their lives in India due to COVID-19 infection and related complications. At the beginning of the pandemic, it was thought of that this particular infection affects lungs and respiratory system. However, very soon we came to know that apart from lungs and respiratory system, it can also affect many other systems in the body. It was initially learnt that patients who have pre-existing heart disease and risk factors related to heart disease, they are at a higher risk of developing severe COVID-19 infections. But later on we found that COVID-19 infection itself can cause severe heart related and circulatory system related complications which can be life-threatening at times. First and foremost, there are different levels of COVID infections. There are mild, moderate and severe cases of COVID-19 infections, and even the complications may differ from person to person. If we look at the overall cases of COVID-19 infection, less than 1% of individuals have involvement of heart and circulatory system. But if we only concentrate on severe cases who require intensive care unit treatment, so in this severe infections, almost 15 to 20% of individuals develop heart related complications and many of them die because of heart related issues. Patients who have previously diagnosed with diabetes, hypertension, dyslipidemia or previous pre-existing heart related disease or kidney related disease or past history of smoking, they are at a higher risk of developing severe COVID-19 infection compared to somebody who is a normal individual without any risk factors. The mechanism of cardiac involvement in COVID-19 disease is multifactorial. The initial understanding about the COVID-19 disease was that the patients who are developing severe respiratory infections, they have many other systemic changes, like some of them have hypoxia. Hypoxia means low oxygen saturation, which can directly affect the function of the heart. Some of them have low blood pressure, and this low blood pressure can affect the muscles of the heart. Apart from them, some of them have viremia, that means the COVID-19 coronavirus is circulating in the bloodstream and there is a response to this particular virus or virus related products, and that can directly affect the heart of the individual. But as we saw more and more cases of heart involvement in COVID-19 disease, our understanding about the COVID-19 and heart related disease has evolved, and now we see different variety of cardiac involvement as well as different mechanisms which are responsible for development of heart disease in COVID-19 patients. One of the most important mechanism is direct injury to the cardiac cells, that means cardiomyocytes. Now we have seen that patients who develop severe COVID-19 infections, apart from entry into the lungs, this particular virus can get entry into the heart cells, that means the muscles of the heart. They are called cardiomyocytes. Now this virus or the toxic products from the virus which enters inside the cells of the heart can cause direct dysfunction of the muscles of the heart, and overall the direct damage to the muscles of the heart leads to pumping failure of the heart. Remember, our heart is made up of muscles, and it keeps beating or keeps pumping the blood continuously 24/7. But if some part of this particular organ is damaged because of direct invasion of virus into the cells, it can lead to pumping dysfunction of the heart. So the pumping capacity of heart is reduced, and these patients may develop low blood pressure, low cardiac output, and reduced blood supply to different organs of the body can actually affect multiple organs of the body, and they develop very severe form of disease. Now many of these patients also have immune complex formation in the blood. Immune complex means the virus which enters inside the bloodstream, there is some response from the body side to this particular virus and the viral products. So body tries to fight against the virus cells, and that creates a response, an immune response, and formation of immune complexes. Now this immune complex and this response can actually directly affect the heart muscles. So whenever we have exaggerated immune response, it can lead to dysfunction of the heart muscle cells. So that is called myocarditis. Dysfunction of the heart muscle cells because of the direct or indirect effect due to entry of viral cells inside the bloodstream. So this myocarditis, if not diagnosed on time and not treated properly, can lead to long-term LV dysfunction. That means long-term pumping failure of heart, and sometimes it can be fatal. Many patients die because of the cardiac complications of myocarditis. Now apart from myocarditis, there are many other mechanisms, and one of the mechanism is cytokine storm. So many patients have hyperinflammation inside the blood vessels like arteries and veins of a particular patient who has COVID-19 disease. So this kind of hyperinflammation can damage the inner layers of the arteries and veins, and this damage to the inner layer of the arteries and vein leads to formation of blood clots inside the arteries and veins, and these blood clots can actually occlude the blood vessels, and which results in reduced supply to the important organs of the body. Now remember, if this particular blood clot forms in an artery which is supplying blood to the heart muscles, it can lead to heart attack or myocardial infarction. Similarly, this kind of blood clots can form in the arteries which supply blood to the brain. So if a person develops blood clots inside the brain arteries, it can lead to stroke or paralysis attack. Similarly, this kind of blood clots can develop in arm or lower limb arteries and can give serious symptoms to this particular organs. And sometimes we see formation of blood clots inside the lung arteries, and that actually obstructs the flow to the lungs, and that is called pulmonary embolism, which can be life threatening at times. So these are very important mechanisms how a person of COVID-19 disease develops a heart attack. So initially we thought that it's a respiratory problem, but now we are seeing a lot of patients coming with heart attacks or strokes or even pulmonary embolism. So this is how they develop this kind of complications. So here is a very interesting case of COVID-19 disease and heart attack. Here is a case of a 33-year-old gentleman who presented with acute onset chest pain. Comes to hospital, we took an ECG and that shows a heart attack. So as per protocol, we do various investigations to rule out COVID-19 disease. The RT-PCR for COVID-19 is positive. The other blood investigations and CT scan also proves that it's a COVID-19 disease. Now as per protocol, we perform an angiography for this particular gentleman, and we see that the right side artery which is supplying blood to the muscles of the heart is totally occluded. Now we perform an emergency angioplasty with thrombosuction, a procedure called thrombosuction for this young gentleman, and we can see that there is lot of thrombus, blood clots inside the right side artery, and with the technique of thrombosuction we sort of remove the blood clots from the right artery and we open up the blood flow in the right coronary artery. Since he was a young gentleman, there was no hard blockage, no cholesterol plaques inside. We could manage with thrombosuction, where we remove the blood clots, establish the blood flow we gave some of the blood thinner inside the right coronary artery, and we could achieve a normal blood flow without putting a stent inside. So this is a very classical example of COVID-19 disease presenting as a heart attack. Now, apart from myocarditis and heart attack, that means myocardial infarction, many of COVID-19 patients are coming with complaints of palpitations, and they have abnormally fast or abnormally slow pulse rate. So that is called arrhythmia. So presence of arrhythmia is also very common finding nowadays in a patients with COVID-19 disease. It is a direct involvement of the conduction system of the heart because of the COVID-19 infection. Now, apart from direct involvement, some of the stress which happens in this group of patients can also indirectly lead to development of palpitations or arrhythmia. I would like to share two cases, the recent two cases where we had abnormally slow pulse rate. We call it bradycardia, and the ECG showed complete heart block. That means there was no coordination between the different chambers of the heart. So in such cases, we may even require implantation of permanent pacemaker to stabilize the heart rhythm and improve the pulse rate of a patient. Yes, heart related issues are encountered during the active COVID infection as well as after recovery from COVID infection for initial couple of months. And we have seen cases of myocardial infarction, that means heart attack, stroke, that means paralysis attack, and sometimes pulmonary embolism during the initial 2 months after recovery from COVID-19 disease. Now, why these patients develop complications even after recovering from COVID-19 disease? It is because they have a prolonged pro-inflammatory or hyperinflammatory phase, which is responsible for stagnation of blood, formation of blood clots, and which ultimately leads to myocardial infarction or stroke or pulmonary embolism, and in many cases even blood clot formation in the arm or leg arteries. And how to identify these individuals who are at a risk of developing this kind of complication is, there are certain important blood parameters. We call it markers of inflammation. So these markers of inflammations are very important parameters. If somebody who has these markers elevated in the bloodstream, they are at a higher risk of developing heart related complications during active disease as well as after recovery from the active disease for initial 2 months or so. Now, these individuals can be identified, and if they are treated well with blood thinners or steroids for a longer time, we can actually avoid the heart related complications and we can avoid the heart attack, strokes or pulmonary embolisms. So patients who are having inflammatory markers elevated, they should be prescribed appropriate blood thinners for next couple of months even after recovery from the active COVID-19 disease, and this can actually avoid the complications related to heart, brain, kidneys and many other systems of the heart, of the body. So I would like to share couple of cases where we have complications even after recovery from the COVID-19 disease. So in the first case, there is a 50-year-old gentleman who had acute chest pain 2 weeks after recovering from COVID-19 disease. He had myocardial infarction while he was on supportive therapy for COVID-19 disease. Now this particular gentleman had anterior wall MI, that means the main artery of the heart, which is on the left side of the heart, that was totally occluded, and we perform an emergency angioplasty for this gentleman and we restored the blood flow like a normal artery. Now this gentleman was not on blood thinners, that is why he developed this kind of complication of COVID-19 disease. So such individuals, if we diagnose the hyperinflammation at an earlier state, start them on blood thinners we can actually avoid this kind of complications due to COVID-19 disease. And even after an angioplasty or complete recovery from heart attack, they have to be on good blood thinners for a longer period of time, because they have a tendency of formation of blood clots. So it is very important that we identify such individuals and treat them with appropriate blood thinners and steroid therapy. Now the second case is an elderly lady who had COVID-19 1 month back, and now she comes with complaints of swelling in the arm, the right arm, and associated with pain for last 2 weeks. And when we examine her, she had a significant swelling and she was not even allowing to touch her right arm. And on angiography, we could see that the right arm artery was critically occluded with thrombus. So there was lot of blood clot inside the right side arm artery, and fortunately it was diagnosed timely and she was started on very strong blood thinners to dissolve the blood clots. And after a couple of weeks she had significant relief in symptoms. All the swelling came down, the pain also subsided, and the repeat sonography of the arm showed that the blood flow has significantly restored. So this is how we can diagnose the problems related to heart and vascular system even after recovery from the COVID-19 disease. And if we diagnose them at a correct time and take proper action, we can avoid the mortality and more severe complications. There are certain important symptoms which can actually tell us that there is a possibility of involvement of the heart along with COVID-19 disease. The most important symptom is shortness of breath along with chest pain. So when an individual has difficulty in breathing and along with that typical chest pain, that is a very classical symptom of involvement of heart in patients with COVID-19 disease. Remember, COVID-19 pneumonia itself can give you symptoms of breathing difficulty. However, whenever it is associated with chest pain or it is out of proportion to the X-ray or CT scan finding of pneumonia, we should consider possibility of involvement of heart in that particular patient. Now remember, simple investigations like ECG, blood investigations and echocardiography can diagnose the problem related to heart, and we can come to a conclusion whether heart is involved along with COVID-19 disease. Now once we diagnose it at a correct time, we can take important corrective measures at the earlier stage, and it can be life saving for that particular individual. Apart from breathing difficulty and chest pain, palpitation is also one of the very important symptom in patients with COVID-19 disease. Abnormally fast rhythm or abnormally slow rhythm both can give a person symptoms of palpitations. Scientifically we call it arrhythmia. Now taking a simple ECG can give us a diagnosis of arrhythmia in patients who encounter complaints of palpitation. Apart from this, fatigue, undue perspiration, lethargy, giddiness or swelling in legs, that means edema, these are other important symptoms which can be encountered during active disease as well as in the post-COVID recovery phase. So anybody who has any of these symptoms, they should come to medical attention as early as possible and consult your cardiologist or physician at the earliest, so that we can diagnose if there are any heart related problems. Now we already discussed how COVID-19 affects our heart and circulatory system. What are the important symptoms related to heart disease in presence of COVID-19? But the most important aspect is to understand how can we avoid cardiac involvement in a patient with COVID-19 disease. So remember, the most important step in preventing cardiac involvement in COVID-19 disease is get your investigations done as early as possible. If you have symptoms suggestive of COVID-19 disease, please go to the medical attention as early as possible, consult your physician and get yourself checked for COVID-19 disease. If we diagnose this particular infection on time and we start treatment as early as possible, and in certain cases where we are suffering from severe infection, if the steroids and remdesivir like drugs are started at a correct time, we can actually avoid the phase of hyperinflammation. We can actually avoid the involvement of other organs like heart, kidney, brains and many other systems of the body. So timely diagnosis of COVID-19 infection and starting treatment at a correct time is the most important aspect in avoiding the involvement of heart in a patient with COVID-19 disease. Now, even if a person who has a COVID-19 disease has a heart related problem, don't panic. It is very important that it should be diagnosed at an earlier stage, and if a patient is treated with drugs like steroids or blood thinners, appropriate blood thinners, we can actually avoid the more severe complications related to heart and vascular system. Many of the myocardial infarction, stroke, pulmonary embolism in the presence of COVID-19 disease could be prevented because of drugs like steroid and appropriate blood thinning agents. And remember that even after you recover from COVID-19 disease, in certain cases this blood thinners has to be continued for next couple of months, because there is a phase of hyperinflammation which is present during these initial months. Apart from medications and earlier diagnosis and treatment, it is very important that we keep ourselves hydrated. So drink lot of water, fruit juices and many other liquids so that we are not dehydrated. Dehydration is one of the important factor which precipitates this kind of complications, and there is a tendency of blood clot formation in the circulatory system. Apart from medications and hydration, it is very important that we remain physically active. So some amount of activity is mandatory for everyone. If we take a complete bed rest, there is no physical activity, in that case there is a possibility of stagnation of blood flow and a person is at a risk of developing blood clots and complications related to formation of blood clots. All this information provided by us is based on the extensive clinical research done in different parts of world and based on our own clinical experience in the last 1 year or so. And our clear message to the community is, if you are suffering from COVID-19 disease, please get a medical attention as early as possible, and especially when you are suffering from the important symptoms which can suggest a heart related involvement like breathing difficulty, chest pain, palpitations, swelling of legs or lethargy, fatigue. So these are important symptoms. Don't ignore these symptoms, and if you are suffering from this kind of symptoms, please go to your cardiologist or physician as early as possible so that we can diagnose the heart related problems at an earlier phase and we can give the corrective treatment so that we don't develop severe complications related to heart and circulatory system. Finally, I would like to thank all of you, and if you have any of the questions or queries regarding to this particular subject, you can directly contact us. Our contact details are provided at the end of the video. Thank you.